Hi, this video is about how in my practice I approach the control of pain after surgery. We want to have a technique which is basically flexible, maximizes safety, but at the same time maximizes your comfort. Let's talk about narcotics first. In general, people that we think are having procedures that tend to have more discomfort, we're going to suggest using the stronger medicine oxycodone. For those that we think are not going to have that much discomfort, we'll scale that down to what we think is a little bit less potent using Vicodin. Vicodin's interesting. It's one of those medications that's been around a long time, and it was always combined with Tylenol. So we actually like the idea of separating both the narcotic pill and Tylenol out separately. We can do that with the oxycodone, so it'll come without Tylenol mixed in it. Because hopefully at some point in your recovery, you might benefit from the Tylenol, but not need the oxycodone anymore, and we like that. Unfortunately, Vicodin is basically a combination drug, so while you're taking that, you can't take Tylenol in addition. In our society, narcotic medication is very tightly controlled. In other words, once I write a prescription, it has to be sent by computer. When it arrives and once you pick it up, they're tracking how long before when you pick it up do you receive some more. We like to get these medicines out just after the pre-op visit. That's usually 2 to 3 weeks ahead of the surgery. Therefore, if you need more that's before that sort of timeout period, we can still do it. We try to keep the amount of narcotic medicine you take to be enough to make you as comfortable as possible, but also keep you safe. So a couple of things we think are now best practices. One, if you need the medicine, take it. It used to be said is that don't get behind the pain. In other words, take it because you might feel discomfort. I don't think that's responsible anymore. If you need it, take it. On the other hand, if you need 2 pills every 4 to 6 hours versus 1 pill every 4 to 6 hours, and that's within the guidelines of prescription, take what you need. In general, we're not going to let you sort of run out. Never really ration the medicine. On the other hand, you've got to communicate with us. If you're getting low on medicines and need some more, you got to get in contact with us during business hours to refill it. Society is no longer going to let after hours and weekend prescriptions for narcotics be a common occurrence. Let's talk about an alternative to narcotics. Journevax is a new medicine. This medicine has the same effects on pain relief as oxycodone, but it's not a narcotic. And so for those patients that would like to avoid narcotics, it's certainly an option. Our recent experience suggests that it's effective, maybe not as effective as oxycodone, but still a great option for those who, for whatever reasons, think that narcotics are not in their best interest. So the second type of medicine we're going to use is Tylenol. We're all familiar with that. It's not the best painkiller, but it helps some. And we want to do things so we're minimizing the role of the narcotics. So we're going to ask you to take either 2 of those 500 tabs 4 times a day, or 2 of those 325 milligram tabs of Tylenol 6 times a day. The truth is we want to stay below that 4,000 milligrams a day maximum. That's the safe level. Ironically, even though Tylenol everybody thinks is very safe, you can really get in trouble with taking more than that amount. So once you get to 4,000 milligrams in a day, you're done. Another medicine we're using commonly, which also is not a narcotic, and it's again trying to minimize the roles of narcotic, is Celebrex. Celebrex is a COX-2 inhibitor. It's a type of medicine like Motrin, but it doesn't have quite the blood thinning effects of Motrin, so I like it in that early few days after surgery to avoid unnecessary bleeding. This will be a prescription you receive. You're going to take 1 of these tabs twice a day. Now, when I send this prescription over to the pharmacist, and the way we have systems in this country, the pharmacist is going to think I'm treating you for arthritis. I'm not. I'm giving you something for your post-surgical discomfort and to keep you safe. So you may have to tell them, no, we're not trying to get the insurance company to approve this. They're going to suggest it's somewhere between $10 to $30 out of pocket to get this medicine. It also has a refill. After 5 days, you can get more. That's for the person who says, this stuff worked great, I need more of this. But for others, you can probably switch to Motrin at this point in time, because at 5 days, I'm really not worried too much about bleeding or bruising being a problem anymore. The other thing we're trying to treat with our preoperative medicines is everything we can do to prevent you from having nausea and vomiting after surgery, because that's no fun. So everybody's going to get a medicine. The brand name is Zofran. That's going to be taken about every 4 to 6 hours if you're sick to your stomach. But also, for those people that have a history of motion sickness or previous nausea and vomiting after surgery, we add on the medicine copolamine. That's the patch you put on behind your ear if you're going on a cruise or something. And we found that's been very helpful, sort of increasing the success of preventing that post-operative problem. For those patients that have facial surgery, we ask them just to put the thing on the wrist because we don't really want it here in our surgical field at the time of surgery. These patches are probably best applied the morning of surgery so it's well in your system, or can be applied the night before. Also, I tell people is that I encourage them after 2 days, take the thing off, because I've seen people with sort of subtle side effects of the medicine have left it on for 3 days.